Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafa Day, and welcome back to Healthy Living. We are talking about household poisons in your home, which children or adults may consume, and what do you do if they do? And Dr. Jitka Lom is here from ExpressCare to answer some of our viewers' questions. All right, Doc, our first viewer is asking, what are the most common poisons that children accidentally consume?
Yeah, so I think the number one would be tablets, pills that adults have left lying around. The other one is button batteries. You know, you change the battery in your small device and the child picks it up and swallows it. And the third one is actually dishwasher detergent, those pellets. They kind of look like candy. And other things that may be under your sink. We tend to keep things under our sinks, and of course there's those child locks that help keep things safe. But just if you have a toddler or a young child, just keep those products up above the sink rather than underneath.
Yes. All right. Now our next viewer is asking, what tips would you offer to prevent accidental poisoning of children?
Right, well, I guess those three, just keeping things away from the child, using your child locks, and then for pills and medication, making sure that you explain it's not candy and you keep it up in a safe place in a proper child lock bottle. The problem is when people have their pills in a pill container, you know, just the one for the 7 days or whatever, they can just flip the top and the child can open that easily and eat all the pills in there, all the blood pressure pills, all the everything. Yeah. So you want to keep that away from your children.
Yeah, I remember when my son was younger, my firstborn, when he was younger, I used to keep whatever pills I had in a container, and then I padlocked it so that he couldn't get to it, because my kids, unlike most kids, they like taking medicine.
Yes, it's true. Well, they see, you know, kids mimic what we do. So same with the cleaners. They see mommy spraying Windex, they want to touch the Windex, and they want to taste the Windex, same thing. And same thing with the pills. So we want to inform children that these are medicines, they taste bad, and we don't want to have them eat them.
Yes. All right, so moving on to our next viewer's question. Can mouthwash be dangerous if consumed? It's an interesting question, because I've seen this. Someone consumes so much mouthwash on TV, of course.
On TV, yeah.
But this is
strange. Well, mouthwash has a few ingredients. It's got an alcohol in there, not the alcohol that you would want to get drunk on, but there is an alcohol in there, and there's several other chemicals that can cause problems for you, and you can overdose on it. So when you're swishing, you should spit, not swallow. Definitely.
Yeah. You know, in relation to mouthwash, toothpaste is another thing that children get a hold of quite easily. And on the on the container, it does say, you know, do not consume.
Do not consume large amounts. Yeah. So toothpaste is another problem. Parents just try, and they taste so good and they're cute and everything, pink and blue, for children. So try to keep the toothpaste away. If your child did eat a lot of toothpaste, it would be very unusual for a child to get very sick from that, but they could get uncomfortable and vomit. Yeah.
Okay. Yeah. I always wondered what would happen.
Yeah. Just mostly vomiting.
Yeah.
You wouldn't have any severe. Most of the poisonings, again, can be handled at home, and they're minor, where there's just basically a waiting time for all of this to pass. Yeah.
Okay. Now, our next viewer says, I heard Mouthballs can be absorbed dermally. What does that mean?
So mothballs have naphthalene in them. They're a killer. We put them in the store your clothes, especially wool, so that the bugs don't eat your clothes. But the naphthalene can be absorbed through the skin. Many things can be absorbed through the skin. Many chemicals, especially pesticides, can be absorbed through the skin. So farmers and so on that are using pesticides should cover up, because that can go through your skin and create all kinds of symptoms. But the mothball one, I'm not sure exactly how that would transpire, how you would be absorbed as so much mothballs, but you should be covering up if you're exposed to a lot of mothballs.
And just another question related to that. You know, you buy a package of beef jerky, and in there are the freshness little freshness packs, and it says "do not eat" on there. Now, you know, children, of course, some children think that like the
Candy.
prize in the cereal box or something, like additional
Yeah.
candy. So why shouldn't they consume,
Well,
or what would happen if they consume that?
Not a lot. Most of the time in that package it's silica. Silica absorbs moisture, and that's why it's in there to keep the beef jerky dry. So not much would happen to you. I don't think anything would happen to you, but it's not made for consumption. Silica is basically like a type of sand, you know.
Okay, okay. Now, moving on to our next viewer's question. This person asks, are there certain items I should keep around the house in the event of an accidental poisoning?
Really, you shouldn't be treating with any type of charcoal or, we said the Ipecac. You should just have the poison control number on your phone or on the refrigerator, 1-800-222-1222, so that if anything should happen, you have somebody an expert to call and ask specific questions about your specific situation. That's the best thing you can do. As far as any other products or things, no, just don't do anything. Ask for help. We talked a little bit about the button batteries.
Mm-hmm.
If you think your child swallowed a battery, you need to get to the hospital immediately. Those ones can lodge in the esophagus and burn right through it. So
wow.
that treatment has to be instituted within a couple of hours. So by the time you get to the hospital and they get your x-ray done and all that to see where the battery is, that takes time. So if you think your child swallowed a battery, you need to get to the hospital.
All right, Doc, any final comments?
Just use the child-proof containers and keep the chemicals away. If you can, try to use natural cleaners. Baking soda works really well with vinegar, and that won't hurt anybody, or a steam cleaner. Those type of things will do really well in your home without any hazard.
All right, thank you so much.